Okay, let's dive right into an essential first aid explainer covering a super common household crisis, especially if you've got kids running around. We're talking about managing a foreign body in the nose. It's one of those sudden, panic-inducing moments that requires calm, swift, and correct action. So in this explainer, we're going to walk through exactly what you need to do step by step. Let's get right into it.
Now, when someone, usually a toddler, sticks a small toy or a stray piece of food up their nose, we kind of just think of it as a painful annoyance, right? Just a nuisance. But what is the real danger here? Well, there's actually a much bigger, hidden hazard that dictates exactly why we have to be so incredibly careful in how we respond.
So the absolutely crucial point here is that the primary risk isn't just local discomfort or a stuffed-up nasal cavity. The major threat is inhalation, what doctors call aspiration. This means the object could accidentally get sucked backwards and go straight down into the lungs. And wow, that turns a manageable minor problem into a severe, immediate respiratory crisis. So everything we do next is all about preventing that from happening.
All right, Section 1, the adult first aid method, known as close and blow.
Okay, so if the affected person is an adult or an older child who can actually follow basic instructions, there is a strict precaution you must take before trying anything else. You've got to ensure they avoid taking any deep breaths through their nose. Remember that aspiration risk we just talked about? Taking a sharp inward breath through the nose to, say, prepare for a sneeze or a blow is exactly how an object gets sucked further in. So instructing them to breathe strictly through the mouth is, well, actually, scratch that. It's not just an instruction. It's absolutely mandatory until the situation is safely resolved.
So here are the 3 simple steps for the close and blow method. First, ask the person to press a finger firmly against their unblocked nostril to close it completely off. Second, have them blow out gently through the affected nostril. The key word here is gently. We definitely don't want to cause internal damage or sudden pressure shifts. And step 3 is vital for safety. If the object doesn't come out in 2 or 3 attempts, you've got to stop. Only try this blowing technique a couple of times. Seriously, do not keep forcing it.
Moving on to Section 2, toddler first aid, specifically the mother's kiss technique.
But what if the victim is a toddler who literally can't blow their nose on command? Or maybe they're just too panicked to follow your breathing instructions. Well, the mother's kiss technique is perfectly designed for them. It relies entirely on the principle of positive pressure. Essentially, you're acting as a gentle pneumatic pump. You're using a carefully delivered puff of air to travel up the child's throat and literally pop the object right out of the nasal passage from behind. It's basically just simple physics applied to first aid.
And here is exactly how you execute it safely. Step 1, place your mouth completely over the child's mouth, making a tight, airtight seal, kind of like you would in CPR. Step 2, use your fingers to press their clear, unblocked nostril entirely closed. Step 3, blow a quick, firm puff of air directly into the child's mouth. That puff of air travels up the throat, enters the back of the nasal cavity, and forces the object right out of the blocked nostril. I know it sounds a bit unusual, but it's an absolutely invaluable first aid tool to have in your parenting arsenal.
All right, Section 3, red flags and exactly when to seek professional medical services.
Now, we really need to outline exactly when you have to abandon these at-home methods and seek immediate professional help. We're separating simple mechanical blockages from serious chemical or vascular threats here. Let's break down the most critical and time-sensitive dangers you need to watch out for so you know exactly what you're dealing with.
Let's look at the absolute worst culprit first. If the foreign object is a button battery, those tiny, flat, shiny batteries found in watches, key fobs, and small toys, this is immediately a life-threatening emergency. Why? Well, because the battery can rapidly react with the natural moisture inside the nose. This creates an electrical current that causes severe, destructive chemical burns in just a matter of hours. Do not wait around. Do not try the mother's kiss. This requires rapid medical intervention, for sure.
Similarly, if multiple magnets get inserted into the nose, you've got a major emergency on your hands. Magnets can attract each other really tightly across that delicate nasal septum tissue. When they pinch that tissue together with continuous force, they completely cut off the blood supply. And that can quickly lead to tissue death or necrosis, causing permanent structural damage to the nose.
So just to summarize our strict escalation rules, you must seek immediate medical care without any delay if you're dealing with button batteries or magnets. Furthermore, if you see any bleeding caused by a sharp or penetrating object, or if there are persistent symptoms like severe pain, localized swelling, or literally any difficulty breathing, stop your at-home first aid immediately and get professional medical help.
Now, you know the techniques like the close and blow and the mother's kiss, and they can absolutely save a stressful trip to the hospital if used correctly on benign objects. But, this should also prompt us to look around our homes and ask a pretty tough question. Are we truly keeping these hazardous items out of reach? You've got the tools to handle the crisis now, but the ultimate first aid is prevention. So, are your button batteries fully secured? Are magnetic toys kept totally away from the toddlers? Take a moment today to really evaluate your environment. I hope this explainer empowered you with the knowledge to act calmly and safely. Keep learning, keep your kids safe, and ask yourself, what hidden hazards are lurking in your living room right now? I'll catch you in the next one.